We've got a fairly full afternoon. We've got the launch event, which is obviously the big event of the afternoon, but you're aware that for those of you from primary care and school nursing, we've got a short programme of CPD after the launch event as well for you too. So in terms of where we're going with the launch event, we've got a short promotional video. We're going to hear about the background to the project from Professor Elphick. We've obviously got some thank yous to say. We're going to hear from Dr. Townsend, who's the lead for NHS England for asthma for young people. And then we're going to take a look at some of our content, which is obviously the meat of Moving On Asthma. And finally, we're going to look at where we're going in the future with this project. So, without further ado, all I can say is sit back and enjoy. Now, this is one event where you won't be asked to give any feedback because we're so confident that you're going to think it's brilliant. However, instead, what we have got are these little pieces of paper, and we thought, being a research team, that we'd use the event to do a bit of research. And it'd be really great if you could just click on the QR code and complete our extremely short survey to give us a little bit of an indication as to your experiences of asthma education, particularly within primary care. So, sit back and enjoy our promotional video.
Are you alright? What's up?
This algebra's really stressing me out. Mr. Smith is always picking on me, and my chest is feeling really tight.
If you just relax, maybe you won't have to take the inhaler so much.
It's not that easy, you know. I've got mine here. I can barely even get through netball without it.
You guys have got asthma all wrong. My brother Tim has it as well. He can barely play sports at school. He didn't even make it into the cricket team. He actually had to get sent to the hospital because of his chest. But his nurse redirected him to these videos about helpful tips on how to beat asthma.
Videos? Really?
Well, how's he doing now?
It's hard to believe, but it's almost like he's been cured of it. He's playing sports at school. He's managed to get into the cricket team. He might even choose sports as uni. However, he still carries his inhaler with him, just in case.
What was that about asthma videos? I went to the pharmacy the other week, and there was a big poster in the surgery with something similar. Moving On Asthma, that's what it was called.
Moving On Asthma, that's it. There's a rap about it.
A rap about asthma? Come on.
No, really. It goes, wanna have fun, wanna keep fit, don't want asthma spoiling it, want a life as normal as poss, okay, let's show asthma who's boss. You're gonna be swatting up and swat, here's the weapons you got. You're gonna be swatting up and swat, here's the weapons you got.
You're gonna be swatting up and swat with the weapons you got. You're gonna be swatting up and swat. That's actually pretty cool.
But what's SWAT?
SWAT's the 7 wonderful asthma tips. My brother still uses them.
I've got it. www.movingonasthma.org.uk. That's mad. There's loads of stuff. Learning about asthma, speaking up for yourself, living life well, becoming independent, school and your future. That's definitely one for you. They've even got something about managing your emotions.
Let me have a look.
They've even got stuff about exercise.
Told you.
House dust mites. What are they? Oh, they're gross.
Hang on. I'm ordering prescriptions. This looks seriously useful.
Boring. I'm taking a look at going out with my mates. Can't wait to be leaving the fossils behind.
My mum's always having a go at me for not bringing my preventer around with me. So I guess I could have a look at a few of these tips. The medication ones looks really helpful.
It certainly seems to have helped him, so you should really give it a go. I'd like if you can make the summer camp trip. I really miss when you don't come and hang out with us.
You're so cute. Guys, check it out. I found the rap. Any attack is the friends that you've got that are watching your back. So make sure you tell your friends and teachers.
You set a goal and they help you reach. You're gonna be swatting up and swat with the weapons you got. You're gonna be swatting up and swat with the weapons you got. You're gonna be swatting up and swat with the weapons you got. You're gonna be swatting up and swat. You're gonna be swatting up and swat. Here's the weapons you got. You're gonna be swatting up and swat. Here's the weapons you got. You're gonna be swatting up and swat. Here's the weapons you got. You're gonna be swatting up and swat. Moving on asthma. Asthma education for all the kids and guys like us. Check it out.
So obviously we were hugely indebted to the pupils of the local Westbourne school who really got into the rap. We couldn't have done it without them. So if that's whetted your appetite for moving on asthma, that's great. So I'm going to invite Professor Heather Elphick, the leader of the Respiratory Research Team, up to the stage really to give you some background on the project itself. Thanks, Heather.
Thanks very much, Moira, and hello, welcome to everybody that's come along this afternoon to hear about Moving On Asthma. So I'm going to start the afternoon off really by talking about the reasons why we felt it was important to develop a resource for children and young people with asthma. Moving on to the next slide. Asthma, as we know, is a life-threatening illness for some. There is a serious side to this, and in fact, in the UK, we still have some of the worst outcomes in asthma for children and young people in Europe. In 2014, the UK National Review of Asthma Deaths found that there were potentially avoidable factors in around 65% of the deaths that they reviewed. So moving on again to the next slide, some of the more common findings in the review were around the lack of quality of care during the asthma exacerbations themselves. But there was also some of the major factors that were highlighted were around inadequate information, education and advice on managing asthma. For example, only 14% of the children were recorded to have been given an asthma action plan. And even more importantly, there appeared to be a lack of adherence to any advice that was given, which is important to consider. The NRAD came up with 19 recommendations, and the one that's most pertinent to us in paediatrics was that children and their parents, carers and teachers should be educated on how to manage asthma, with particular emphasis on when, how and where to use their asthma treatment, how to recognise when their asthma isn't very well controlled, and where and who to go to in the event of needing any emergency advice. So moving on. So however, time and manpower are limited. And this report from the Healthcare Safety Investigation Branch in 2021 showed that really nothing very much had happened in the 7 years since NRAD in terms of moving on with asthma care. So only one of the 19 recommendations from NRAD had actually been implemented. There was still a lack of understanding about the potential seriousness of asthma. And the death rate in the UK was still amongst the highest in Europe. GPs had identified that they were keen to communicate with their patients around asthma, but that they needed help and they needed resources. And despite knowing from the research that self-management of asthma is very effective, there still weren't any resources for the young people with asthma to help them to manage their own asthma. But the good news is that things are now changing, and recognising this ongoing need, there have been some really excellent developments in recent times. So, for example, the all-party parliamentary group that was set up has again recommended that changes need to be made in order to change outcomes. The government's invested money, both nationally and locally, in initiatives such as the National Asthma Bundle of Care. Our colleagues in the North East have produced the Beat Asthma website, which gives some really excellent resources to professionals working in asthma, and we'd highly recommend that people look at those as well. But alongside these other developments, we decided to develop the Moving On Asthma resource for the young people themselves. So moving on to the next slide, which sadly highlights the fact that our resources are needed more than ever. Katie Bulpitt very tragically died only 2 years ago with a severe asthma exacerbation, and her mother is now campaigning for more awareness of the potential severity of asthma, particularly amongst teenagers. So, moving on to the final slide, we feel that now is the time to present the Moving On Asthma website, which we hope will help people, professionals in tertiary, secondary and primary care in all aspects of care for children and young people with asthma.
Thanks very much, Heather. Obviously, we should be flashing up the time is now, because the time is now for Moving On Asthma, isn't it?
Yes.
It's really great to hear about that. Do you want to give us a little bit of the background into the development of Moving On Asthma?
Yep. The development of Moving On Asthma has really taken place over the last 3 years. One of the initial stages, of course, was that we needed to find some funding in order to do this work. And we were very fortunate to have been supported by a number of funding sources to help us to carry out the work. The first stages of the development were really to sort of consult professionals and young people on the content of the materials and the presentation, and we're very grateful to Rich, our designer, for running some workshops with children and young people right at the very beginning, where we really had some fun outcomes from that in terms of what the children wanted this to look like. And then it was the creative process, which has taken quite a while, hasn't it, Moira? But I hope that when you see the resources on the website that you'll agree that they really are a really great way to present the messages that we want to get across to young people. We couldn't have done any of this without the young people that took part really throughout the whole of this development process. We couldn't have done it without their input. So we're very grateful to them.
Yeah. We started off, didn't we, just coming out of the pandemic, really, and we had a real star in Georgia who was a prospective medical student who was probably the only non-camera shy young person we could find at the time, but she gave us hope, and since then we've managed to engage with a lot more young people. It sounds like we've got lots of people to thank, Heather.
We have.
Cue the thanks.
Yeah, and I'm going to need to make sure I don't forget anybody. So, we have got loads of people to thank because there has been input from all sorts of sources to help this to come together. So I'd like to first of all thank St Timothy's for the use of their facilities in helping us to stage this launch event. And thank you to the people that are here today helping to run it. So the tech support, I would really like to thank the people involved. So we've got Glyn on sound, we've got Barry on the visuals, and we've got Bill and Amanda behind the cameras. And we have James, who's just here making it all work. So thank you very much to everybody there. Thank you to the Children and Young People's Med Tech Cooperative team for also helping us to organise the event today and for supporting us with the behind the scenes work. Then I do want to thank all of the funders. So there have been various bits of funding that we've managed to sort of secure in order for this project to be completed. First of all, Innovate UK, also Children and Young People's MedTech Cooperative, Tiny Medical Apps, with whom we are going to be working on this in the future, the South Yorkshire and Bassett Law Integrated Care System, and the NHS England Healthier Together Fund. And I do also want to make a special mention to Arif Shivji, who helped us to navigate some of these funding processes. I also want to thank Jane Townsend, who we're going to be hearing from later, who's the NHS England Children's Asthma Lead, who's been a really positive advocate for this study all the way through, hasn't she? Again, I want to thank Nicola Rigby and the Westbourne School Drama Group for their amazing promotional video. We were really pleased with that and with their enthusiasm for starring in the promotional video. I want to thank the young people and volunteers from all around the country, actually. So we've had the Youth Forum in Sheffield. We've spoken to a group of young people in the northeast of England, Liverpool and Kent, and their input has been in the creative process itself, critiquing what we've done and giving us honest feedback, and actually also performing in some of the videos as well. I'd like to thank Lynn Rishworth and Rex Domino for the time that they gave up for producing the wrap. And if you haven't seen that yet, then that is a treat in store for later on this afternoon. I'd like to thank Lucy Davis for the website design and for really making it so easy for us in terms of actually getting the information onto the website. And last but not least, I would like to thank Rich Wells from Make Better Studio for his amazing animations and cartoons, and just for livening up these videos and making them come to life. And we've got something for Rich, if you'd like to come up to the stage. Yeah, open it now. Open it now.
Okay. That's very cool. Thank you very much. Like that.
Thanks very much, Rich.
Thanks, Heather. I hate to think how long the list would be if you won an Oscar, but we don't have to worry about that today.
No, we don't.
So I think what we're going to do now, aren't we? We're going to sit back and listen to Jen, who's going to talk a little bit about the resource. So we've got Jen Townsend, obviously couldn't be with us today, but as we've mentioned many times before, she's been a real inspiration to us in our journey.
Hello, my name is Jen Townsend. I'm a paediatrician in the northeast of England and the National Clinical Lead for Children and Young People's Asthma at NHS England. We know that the UK has amongst some of the worst asthma outcomes in the developed world, and NHS England, as part of the long-term plan, made a commitment to improve asthma outcomes for children and young people. And part of achieving that goal is to ensure that patients are educated and empowered so that they're able to self-manage their asthma. But different groups of patients have different needs, and young people in particular are a unique group, and the best way for them to understand and receive information is different to almost any other age group. And this is why the Moving On Asthma videos are so important. They've been co-designed with young people to give them the information that they want to get in a way that they want to get it. From patient stories to catchy raps to easy to understand cartoons, these videos are a fantastic way to empower this group of patients to allow them to self-manage their own asthma. So please go in, watch some of these videos, signpost your patients to them and spread the word so that together we can reach as many young people as possible and empower them to self-manage their own asthma and give them their best possible control and leave them free to go off and do the things that they want to do as young people. Thank you.
So we're going to do exactly what Jen's suggested now, and we're going to have a presentation which is really all about watching and sampling some of the videos. So I'm delighted to welcome to the stage Nikki Barker, who's been the project lead for the Moving On Asthma project and is going to talk us through some of our content. Thank you, Nikki.
Hi, so yes, thank you very much, Moira. So as Moira says, I'm Nikki Barker. I have been an integral part of this project right from the start, but I also want to just share with you that I'm also a clinician, I'm a physiotherapist, and so I've just got a little bit of experience alongside this about how I've then integrated this into my practice as well, so I can bring it to you from different directions. So just really as a bit of a kind of a summary so far, this project was born out of the belief that patient education is vital in achieving the best outcomes through optimal self-management. And this is a view that is supported by significant pieces of work that Heather has already mentioned, such as the National Review of Asthma Deaths. But it is particularly important for this age group. It's important for young people because they are making that move from having their parents direct their care and make decisions for them to that point where they are self-managing, that they need to make those decisions, and they need to make decisions based on good information and good knowledge. So thinking about the content, the team at Sheffield set out to create resources tailored to the needs of young people. These resources are structured around the 7 pillars of the Ready, Steady, Go transition programme, and I think many of you will be familiar with that position. Are we able to see those on the screen? I think we're just having there we go, that's lovely. So you'll be familiar with those pillars. So the pillars are knowledge, self-advocacy, health and lifestyles, activities of daily living, vocational, psychosocial, and transition. And when you're looking at the website, and we have some computers set up in the lobby during the break if you want to have a little bit of a look while you're here, you'll see that they are very familiar if you're already using the Ready, Steady, Go transition programme. So where can you find the content? This is the big question. So accessing the content. So what we did is we have created a website, and the website is the kind of primary home for these resources. You can also find them in other places, so you can access them directly via YouTube, and there are other websites that are now hosting these resources. And if we can have a look at the next slide, that will just show us the web address. So examples of places where you can find the resources are things like the Beat Asthma website, that's already been mentioned so far. The other thing to tell you is that there is a contact us facility on the website. We are completely aware that guidance for asthma changes quite rapidly. So if there's anything that you spot that you think needs updating, we are then able to then take those comments and build them into our sort of future changes, as we're going to have a rolling programme to make sure that the resources keep up with the inevitable changes. So let's then think about the central concept. So this is the next slide. We have been dangling the carrot of this wrap, and the central concept for the whole kind of package of information is SWAT. So SWAT stands for the 7 Wonderful Asthma Tips. And we came up with this idea of presenting it in a wrap format. Moira, I have to say, needs to be credited for that suggestion. I'm not sure that I ever thought that you could deliver asthma education in the form of a wrap, but it is absolutely magnificent. So we will finally let you see it and hear it. So put your feet up for a couple of minutes and have a little listen to this.
Wanna have fun, wanna keep fit, don't want asthma spoiling it. I want a life as normal as pos. Okay, let's show asthma who's boss. Here's what it's all about, and here's SWAT to help you out. That's 7 wonderful asthma tips, strategic weapons and tactics, designed especially for you, so that you know what to do. Asthma attacks, but you can't fight back. Yes, asthma attacks, but you can't fight back. You're gonna be swatting up on SWAT, here's the weapons you got. You're gonna be swatting up on SWAT, here's the weapons you got. Gonna be swatting up on SWAT, here's the weapons you got. You're gonna be swatting up on SWAT. 1. Reliever where it can't be missed. Never go out without that risk, that's reliever. ID, smartphone keys, don't take any other risks, please. 2. Prevention is better than cure, so that's what your preventer is for. Good days, bad hair days, holidays, every day, even if you feel great, use it anyway. Put a reminder on your phone, put post-it notes all around your home. Use it wherever you got, so it won't be forgot. I know it won't be forgot. 3. Get a plan of your own on your phone and stick to that plan as much as you can. I said 3. Get a plan of your own on your phone and stick to that plan as much as you can. 4. Ain't what you do, it's the way that you do it. Didn't need to tell you cause you already knew it. So grab your inhaler and shake that thing. Know when to breathe out and when to breathe in. When to hold it for a while. A good technique will make you smile. When to hold it for a while. A good technique will make you smile. 5. Asthma got triggers from factories to flowers, dodge the spring showers, but you got the power to keep yourself safe by keeping your distance from anything that brings on the symptoms. Being prepared each and every day for the challenges that life throws your way. You gotta be prepared each and every day for all the challenges that life throws your way. 6. Keep reviewing those defenses, attending review. It makes good senses to see how you're going, cause it's only by knowing the latest situation of your medication. 7. Best defense against any attack is the friends that you got that are watching your back. So make sure you tell your friends and your teachers you set your goal and they help you reach it. We're gonna be swatting up on SWAT and using the weapons you got. We're gonna be swatting up on SWAT and using the weapons you got. Swatting up on SWAT and using the weapons you got. We're gonna be swatting up on SWAT. We're gonna be swatting up on SWAT and using the weapons we got. We're gonna be swatting up on SWAT and using the weapons we got. We're gonna be swatting up on SWAT and using the weapons we got. We're gonna be swatting up on SWAT.
I've been in the privileged position of showing this rap to quite a few people, and the one thing that I think is really notable is how much it makes people smile when they see it. It's a really nice piece of content, particularly from the point of view if you are engaging a young person with the materials for the first time. It's quite a nice entry point, it's quite engaging, and then it allows you then to sort of highlight other pieces of content that will be particularly useful as well. So talking about kind of the other content, and there is a lot of content. We have created content in lots of different creative styles. This helps you to choose content that suits your patient, but also keeps the interest and the variety. So the resources are mainly in the form of videos. They're deliberately quite short videos to keep people's attention. And we have made them, as I say, in different styles. What we're going to do in the next sort of part of this presentation is I'm going to show you videos from a number of the different styles so that you can get a feel for what is available. There are also additional materials on the website. So there are key points, there are quizzes that young people can engage with, and there are also downloadable leaflets and information that you might want to choose to download or point patients towards downloading. So looking at then the different styles, the first style that we're going to look at is what we call the voiceover animation. And this will be the first video that we're going to show you. And this video is about why do I have asthma?
Asthma is pretty common. In the UK, around 5.4 million people are currently receiving treatment for asthma. That's 1 in every 12 adults and 1 in every 11 children. So around 3 children in every class have asthma. The message is you're not alone. Asthma is a lifelong condition, and although symptoms can go away, they have a nasty habit of resurfacing later in life. Why me, you might be asking? That's a tricky one, as scientists are still working hard to fully understand asthma, but a number of risk factors have been identified. It's a family thing. If you have a parent with asthma, you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. Allergies, or atopy, that's when you react abnormally to certain things you breathe, eat, inject, or have skin contact with. Allergies can produce itchy eyes, runny nose, wheezing, skin rash or diarrhoea. Other allergy-related conditions are eczema and hay fever. Other risk factors are smoking, pollution, being born early, nasty infections and female hormones. This may not be you, so don't worry. There's good news for everyone. Whilst a cure for asthma is still to be found, there is lots of advice and treatment to help. Being knowledgeable about your condition and managing it well can also make a significant difference.
Is about house dust mites. So the third style that we're going to show you is what we call a photo journey. The photo journey that we've chosen for you is Nights Out.
Spending time with your mates is great, and there's nothing better than a good night out. It's one of the great things about growing up and becoming an adult. Think hanging out in a local park, a house party, or even going to a club. We're talking serious fun, and you don't want your asthma messing things up. What's the problem now, you may be thinking? My asthma control is really good. Well, there are a few reasons why going out at night can cause problems. For starters, the cold air at night might trigger your asthma, especially if you're walking home late at night. And exposure to cigarette smoke and other substances can cause problems too. This is particularly bad news if you're drinking alcohol, because you might not realise that things are getting worse, and, what's more, you may struggle to act quickly. Then there's the problem of being somewhere unfamiliar. You may not know how to call for help, or even where you are if you do call for help. The good news is, there are a few simple steps that you can take to make sure you're as safe as possible. You don't need to be a party pooper. For starters, to aim for good asthma control, check out SWAT, our 7 wonderful asthma tips, and remember RISK, R-I-S-K. That's your
reliever. Remember to follow the advice in your asthma plan, and don't be afraid to call an ambulance if you take 10 puffs and still feel unwell. ID, very handy if you're old enough to buy alcohol. Smartphone, fully charged of course. And keys, your parent or carer might just have nodded off before you got home.
Then,
know where you're going and tell your parent or carer where you'll be. Check out if you're going to bump into any pets. Think antihistamine if you have an allergy. Avoid cigarette smoke where possible. And make sure you know how you are getting home. It's always great to end up in your own bed, and getting a lift can help minimise exposure to the cold air.
Being in control and managing your asthma well is the best recipe for a great night out and for a lifetime of great nights out too.
So the final style that I want to show you today is a presenter-driven content, and the one that we're going to show you is the introductory video to the substances section.
If you want a chemical fix, the answer is to exercise.
That's true, but there are other options that are tempting too. However, when considering any sort of experimentation, a little risk management never goes amiss.
Yes, knowing what's at stake and being in control are always important. You may feel invincible, but remember, this is because the bits of your brain that deal with planning and impulse control don't mature completely until about the age of 25.
That means your emotions tend to rule the waves. So it's normal to be more impulsive, to find things exciting and enticing, enjoy. All the thrills tend to involve an element of risk, and this is a great way to master informed decision-making, which in turn will help your brain mature.
Ask yourself what are you comfortable with and what's important to you. Perhaps discuss matters with a trusted adult. Just don't be put on the spot and left to feel like you have to jump one way or the other.
It's all about being prepared.
Yeah. Check out the facts and consider your asthma. Why not take a look at the psychosocial section on the Moving On Asthma website if you feel under pressure from your friends?
What follows is a Substances for Dummies lesson. Remember, all these substances are both harmful and addictive, and so come with government and health warnings. Proceed with caution and don't break the law.
There's certainly no excuse for ignorance.
Have been developed for young people in the transition age group. In clinical practice, I've found at times that there have been some of the videos that I've wanted to use with younger children, and you may choose then in your practice to direct parents towards the resource where they can then supervise their younger child to make sure that they're happy with the content that they're engaging. But certainly some of the content is accessible for younger people. From a professional's perspective, I also find that actually from a professional's perspective there's been a lot to learn from viewing the materials myself. So I would encourage you to have a look and see what will work for you. Just a little bit of extra information. As a team, we're really passionate about making the resources as accessible as possible. The colour schemes have been carefully chosen. The videos are all subtitled, and the subtitles are available in a multitude of languages. What we have done to help people is to create a visual guide that you can see on the slide, so that people can choose their subtitles in an appropriate language without actually having to be able to read the slides to work out how to do that. So that's a helpful feature. The second helpful feature is that the website also hosts some materials that are useful to you as a clinician in the form of posters and business cards that you can then use in your clinical practice if you want to give something to the patient to take away. They have QR codes on them, and they also have the web address on, or you may choose to print off the poster and, for example, have it on your clinic wall where you can make reference to whenever you want to. So to finish, and in conclusion really, I would encourage you to have a really good look at the website. There is a lot of materials, so it's really worth spending a little bit of time just navigating the sections, finding the things that you think will be useful for your patient groups, becoming really familiar with those materials, and then using them in your practice with young people to help them live life well with asthma.
Thanks, Nikki. That's great. Hopefully that will have encouraged people to take time to check out the videos. We do seem to be having a few problems with our GIFs today, but obviously we're flashing out, check it out. And I'd just like to invite Heather back up on the stage now before we finish to explain to us really how these videos have been received so far and what the plans are for them in the future. Heather.
Thanks, Maura. Yeah, so we've presented these videos and you know, the backgrounds for our project to a number of professional groups in South Yorkshire, also in the North East, the Midlands and in London, and we've presented to NHS England, and we've had some really positive feedback and a lot of professional support. We've also had support from the MPRANG, which is the National Paediatric Respiratory and Allergy Nursing Group. Many of them have sort of taken the materials away and are planning to use them in their practice, which is really great. We've had a medical student evaluate one of the videos in terms of sort of looking at how much knowledge children gain from watching the video, he's presented his results at the British Thoracic Society and has recently got his paper accepted for publication, so it's going to be going into a medical journal as well. And lastly, our plans for evaluating and sort of getting more sort of evidence regarding the sort of the impact of what we've created is going to take place in terms of a study in secondary and primary care. So if there's anybody that's interested in knowing more about that, then please do get in touch with us. That's going to be taking place in the early part of next year. But really what we want, you know, what as Nikki was saying, is that you know, we want people to take this information away, have a really good look at it and decide what you think is going to be useful for your patients, and then make sure that they know how to access it.
So in a nutshell, I don't think we're moving off asthma anytime soon, are we, Heather? Ho, ho, ho. No. Obviously, we've billed this as a celebration, and no celebration is complete without a cake. And really what we need here is a wedding cake, because it really does feel like we've been married to Moving On Asthma for 3 years now. So we've got a cake, and the good news is that obviously there are fewer people than we expected, so it may be that we never reach the CPD because we'll be so busy eating the cake. But I think it's your job to cut the cake, Heather, isn't it? So, drum roll, and...
Okay, thank you everybody for coming.
And at this point, I'd just like to say a big thank you for the people that have been watching the live stream. It's great to have you join us from all around the country. Sorry that you can't share in the cake, but if you do want to connect with us, you can do that via the website. We'd love to talk to you if you want to know more, if you want to get involved in our implementation project. Again, it would be lovely to talk to you. So it just is left to me really to thank you for joining us. Hope to hear from you, and we'll move on with the rest of the gathering or the event or the celebration even. And for those of you in the room who are clinicians, we will have a slide. If you could just complete the survey, we'd be really grateful. But it's more time for refreshments, chat to us, find out more. It's great to have you join us.